here with Daragh Connolly, the chair of the FIP's Board of Pharmaceutical Practice, to talk about the new report launched today. Hi Daragh, so what is this report about?
This report is into findings that we undertook as a survey through the Community Pharmacy Section of FIP to go and ask pharmacists practicing in the community what were the positive things about their practice and what were the things that were holding them back from being the best pharmacists that they could be, particularly after the COVID pandemic and the extra stresses that they had in their work, serving the needs of their communities. So what we found was that people really enjoyed being community pharmacists. So 60% of the people who answered the survey said that they were really positive about the future of practice in the community. And of that, 90% of people were very happy with their own competency to take on extra work and expanded scope. So that was a really nice thing to find out, because in a way we knew the burden that people had taken on, and we had wanted to find out if that was going to stop capacity or maybe would people leave the profession. So what we have found from it is that people are enthusiastic about positive practice and about doing more for people. But on the flip side of that, what we've also found is that pharmacists are spending too much time doing things that they shouldn't be doing. And these are the things that are barriers to them being the best pharmacist that they can be. So those results and those findings tell us that we have a willing and capable workforce. However, there's a fragility to that. Because they're spending too much time doing the wrong things, they're finding that hard on their positivity, and in some instances they're finding it difficult in their mental health. We found from the survey that only 10% of the respondents knew that there was places for them to go where they could have continuing professional development around positive practice and their own mental health, which is just to say that they could spot the signs and adapt their own practices to avoid burnout and to be that pharmacist that they want to be. So the body of work that now exists for us is twofold. We want to be able to create a repository for those pharmacists, that there is a resource within FIP where they can continually professionally develop and avoid burnout and have enablers to positive practice. And the second part of that is we're able then to create really good policy documents for member organizations when they talk to government and when they talk to payers, to be able to say we have a willing and able workforce who are diligent and competent, who want to do more, but unless we create the proper space for them to work in and remunerate and resource properly what it is they want to do, we're not going to get full value. So the work that continues from here to the Community Pharmacy Section is going to be really exciting. So this survey is a start of more work to come.